Local 4 News starts now with a breaking news alert.
And that breaking news is coming from the state. Governor Whitmer is tying the state's reopening plans to the number of people vaccinated here in Michigan. And she just unveiled a 4-step plan that will automatically trigger the loosening of COVID restrictions once a certain percentage of the state population that is eligible has received at least one dose of a COVID-19 vaccine. Right now, here's where we stand. Nearly 49% of Michigan residents have at least gotten one shot. The first reopening tier begins when we hit 55%. Nearly everything lifts when we hit 70%. Local 4's Rod Maloney. Local 4's Rod Maloney joining us now live with a breakdown of what happens and what will reopen with each step. Rod?
Yeah, hi. Good afternoon, Everard. You know, the governor has been asked by the legislature quite regularly, what's the plan out? What does it look like? Well, this is what they've actually worked on together, according to the governor today. And here is the thing. She says that as a metric, if 55% of Michiganders end up vaccinated, and then it's 2 weeks after that, in other words, you've had both vaccinations and then 2 weeks, that we can get in-person work for all business sectors, and that's about 4.5 million people. Then she says if we get to 60% of Michiganders vaccinated plus 2 weeks, which is about 4.8 million people, increased indoor capacity to 25%, sports stadiums, conference centers, banquet halls, funeral homes can have increased indoor capacity, and then you can have indoor capacity at 50% for gyms and exercise facilities, and lifts the restaurant and bar curfew. She says she believes that we can get there sometime by the end of May. At least that was her estimation. But she says, you know, a lot of things could happen, so we have to watch for that. In the meantime, when we get to 65% of Michiganders vaccinated plus 2 weeks, which is about 5.2 million people, all indoor capacity limits will be removed, but requires social distancing inside. It also relaxes residential social gathering limits. And then finally, she says we get to 70% of Michiganders vaccinated plus 2 weeks, would lift gatherings and face mask orders. Now, the MDHHS will no longer employ the broad mitigation measures unless, of course, there is something unanticipated that comes along in the spread. So let's hear from the governor about what she had to say about why it is that she's doing all of this.
We may be one of the first that really has put together a plan of this nature, and we're proud of this work. We think that it really is the kind of goal and hope that we need. And it's an opportunity for us to all join arms and to make sure that we get to this goal. Now, it is dependent on people, though, of course, just like everything the last 15 months. It's dependent on Michiganders availing themselves of these incredibly important vaccines.
So the governor ties vaccinations to us loosening restrictions. And I asked the governor, what if we don't get to 65 or 70%? She didn't directly answer the question. She just said she would like to see as many people in Michigan get the vaccine as they can. Reporting live, Rod Maloney, Local 4.
All right, Rod, thank you. Meanwhile, the state's top medical executive says that cases and hospitalizations are trending down here in Michigan, so some good news there. Dr. Johnny Caldoon says that cases are about 30% lower than they were 2 weeks ago, but still much higher than what we saw in February.
Data still indicates that we have broad community spread. This includes spread of the more easily transmitted variants that have been identified across the entire state. The percent of tests that are positive is about 13.2%, nearly 3 times where we were in the middle of February, but down by 4.3% from where we were just 2 weeks ago.